Welcome, everyone. I'll let people continue to join. But we're excited that everyone is here for our HCBS On The Hill webinar. And as people are joining, I'm going to put the stream link text, or sorry, the stream text link in the chat right now. Give me 1 second. I hope, did that go out to everyone?
Yeah.
Okay. If you have any concerns regarding accessibility, please let me know. We do have captioning and ASL interpreting, but please let me know if there are any other concerns regarding accessibility. In the interest of time, I am going to go ahead and get started now, but hopefully, more and more people will join. All right. So again, welcome everyone. This is AAPD, or American Association of People with Disability, and my name is Rachita Singh. And I am the Senior Policy Associate at AAPD. I use she, her pronouns. For a quick visual description, I'm an Indian woman with brown skin, dark brown hair, wearing a patterned blue tank top or tank, and gold earrings with a cream headband and tortoise shell glasses. And I am excited to have our HCBS on the Hill webinar, where we will discuss home and community-based services, direct care workforce, the issues surrounding these topics, and federal legislation on the Hill in Congress and the administration, and what people are doing in regards to these issues. So I'm just going to be quickly going through a couple housekeeping rules and then introducing you to our MC and panelists. So just housekeeping wise, please refrain from putting questions and comments in the chat because of accessibility reasons. That makes it hard for people who are using screen readers. So we'd like to leave the chat only for any sort of tech or accessibility concerns. If you have questions, please use our Q&A function. We are going to leave 15 minutes at the end for Q&A. So we'll be referring back to the Q&A feature for that. And we'll try to get through as many as we can at the end. That was mainly the basic housekeeping rule. Definitely use our stream text link for accessibility purposes. And our MC today is Michael Lewis. I'll let him introduce themselves, as well as our panelists, Nicole Jorwick from Caring Across Generations, Allison Hernandez from Senator Casey's office, and our HCBS advocates, Jennifer Kucera and Mandalay. So Michael, I'll pass it to you now.
Hello, everyone. My name is Michael Lewis. I am the Vice President of Policy here at the American Association of People with Disabilities. For a visual description, I am a white man with short blonde hair wearing a pink plaid shirt and a navy blue blazer. And now we will invite our panelists to introduce themselves, and I call you all Nicole, if you could introduce yourself.
Sure. Hi, everyone. My name is Nicole Jorwick. I use she, her pronouns. I am the Chief of Advocacy and Campaigns at Caring Across Generations. I am a white woman with blue eyes and brown curly hair, shoulder length, wearing a black sweater, and glad to be joining everyone today. I can pass it over to Amanda.
Hi, good afternoon. My name is Amanda Lay. I use she, her pronouns for a visual description. I have brown hair and I'm wearing pink glasses and I'm wearing a pink sweater. And I'm really happy to be a part of this important discussion.
Allison.
Sure. Hi, everyone. Allison Hernandez, she, her pronouns. I am a policy advisor with Senator Casey's office working on disability policy to include the work on home and community based services. It's a visual description. I'm a white female with glasses. I have braids and brown hair, and I'm wearing a pink shirt with a white sweater. And I can pass it to Jennifer.
Thank you, everybody. My name is Jennifer Kuchera. I wear many state and national hats. I'm a chair of Ohio Olmstead Task Force. I'm also on a chair of Ohio's DD Council. And I also work at a Center for Independent Living in the Columbus, Ohio area. I'm also a member of United Healthcare's National Advisory Board for people with complex care needs. And I am very glad to be here today. Visual description, I use the pronoun she, her. I am a white woman with my hair pulled back kind of in a bun ponytail, grayish, reddish hair. I have a blurred background, a blue shirt on, and I'm very glad to be here today with all of you.
Thank you all for those introductions. So we will dive right in with our discussion questions. The first question is a question for everyone, but we're gonna start with Nicole. Can you briefly explain the state of home and community-based services at the moment? What do we mean by the direct care worker crisis? And how are people with disabilities impacted?
Great questions, and probably something that I could talk about for the full hour, but I will not. Really quickly, the state of the home and community-based services, or HCBS system in this country, is full of gaps. It's like a piece of Swiss cheese with a lot of holes in it. There are over 750,000 people that are currently on waiting lists for home and community-based services. And that's only for folks that know that there's a waiting list to be on. We historically, and still, there is really not a great way to measure unmet need, because capturing waiting lists in every state varies so much, and that sort of thing. And part of why there are these gaps in the HCBS system is that it's all funded through Medicaid, and Medicaid is a really complicated system that is funded with state dollars and federal dollars. And because home and community-based services is still overseen by the federal law that makes those an optional service, that's why there can be a waiting list, because states can cap how many people they serve for home and community-based care, where they can't on mandatory care and mandatory things. And mandatory services include things like healthcare, prescription drugs, emergency room visits, but it also includes facility-based care. And that's what we call the institutional bias in the Medicaid system. And that's what leads to that waiting list. And so the current state of the system is that it's not serving everyone who needs it. And also, it is not, we don't have enough workers. So you asked about the direct care worker crisis. When it comes to the human infrastructure, the support for people with disabilities, those are direct care workers. And direct care workers, because of the lack of investment that we've seen from both state governments and the federal governments, and the fact that wages for direct care workers are tied into how much money is going into Medicaid, means that the wages for direct care workers have been stagnant, haven't really been going up, and that leads to high turnover rates, high vacancy rates. And we have data from the state of New York that also shows how that impacts direct care workers. Almost 50%, and this was a New York sample, but 50% of direct care workers need some sort of housing assistance or food assistance because the wages are so low. So in order to address this, we need to address the workforce piece, and we also need to address the access piece, because both impact disabled people. When you don't have the care workers that you need, that impacts the care for, I have a brother that has autism. I should have mentioned that in my introduction as well. And he hasn't had a direct care worker who isn't someone that we know or are related to since the pandemic started. And that's a really common occurrence. And so whether it's a waiting list or you got pulled off of the waiting list, but you don't have the workers to support you, the disabled people are impacted by the current state of the HCBS system. Oh, you're on mute, Michael, just so you know.
Thank you, Nicole. Amanda or Jennifer, would you like to chime in?
I'd love to go next.
Amanda, go ahead.
My problem in the HCBS system is that I have cerebral palsy, and I've been on the waiting list for a long time, and I was denied 3 times because my cognition is normal, but I have a great deal of physical needs. In terms of physical needs, I would classify my physical needs as I need total care. I need assistance with all of my activities of daily living, but my cognition's fine. I have a college degree. And so that caused me to be denied services. And my mom is currently my staff and has been since the pandemic. And we have a lot of problems finding qualified staff because they either don't have the experience or don't have the knowledge or don't have the capability, or the language barrier is a huge problem. So to piggyback on Nicole's point, there's some huge gaps in finding qualified people, and there's also gaps in the funding and the qualifications for services and the waiting list. And the cost of services is a huge burden for people if they have to pick up that cost themselves.
Thank you, Amanda. Jennifer, anything you'd like to add?
Yes, my story is obviously different. Everyone's story is different. I actually resided in a nursing home for a couple of years before I was able to get out and to move into my own apartment. And the only way I can live in my own apartment is because I have split shift caregivers. So they come in the morning and then they repeat their help at night. And I need help with every single activity of daily living. I have a form of muscular dystrophy. So I went the agency model, but only because the agency was small and they literally treat me like I am self-directed. I have had the same caregivers for the last 8 years since I have lived here. So my situation is very unique as far as being able to hold on to caregivers for that long, because the story in all states, including Ohio, where I live, is not the case that I am experiencing. And there are many people that are young that are still residing in nursing homes. And I often say that I know nursing homes are necessary, but I would rather die in my bed younger than go back to a nursing home. So we need to do something as a nation with HCBS services to ensure that people are getting served in their homes, and families are not paid enough for the care that they provide their loved ones. And Amanda should be allowed and able to find caregivers that are not family if she desires that. So we all need to be part of this conversation, because it's not just going to take any one of us. It's going to take all of us working together to fix this problem across our country.
Thank you, Jennifer. Next question is for Allison. What are the priority pieces of legislation that we can urge Congress to take action on related to HCBS that would address a lot of these issues with funding and the care workforce?
Yeah, thank you for that question, Michael. So, I mean, for a lot of folks listening in today, you might already be familiar, but I want to highlight three of the big bills that I know Senator Casey has been championing for a while. So our sort of bedrock foundational bill is the Better Care, Better Jobs Act, which is a bill to stabilize HCBS provider networks across all states and to increase wages for workers and encourage just to really bolster and grow and secure the HCBS workforce. Then we have the HCBS Access Act, which is no pun intended, but all about creating that access piece, like Nicole said. So it incorporates a lot of provisions from the Better Care, Better Jobs Act, knowing that we need a strong and robust workforce to create more access. But it just expands on the fact that we need to ensure that people who want to receive care at home can, and that there's the workforce to do so. And then finally, I think of a more sense of urgency just because it relates to the American Rescue Plan. We have the HCBS Relief Act, which would provide short-term gap funding to states to stabilize, same idea, the service providers, and encourage higher reimbursement rate for HCBS. And this was based on what was funded through the American Rescue Plan. We know that every single state took up this money and was using it during COVID. And so this bill in particular looks to expand or to continue that funding, which will sunset in 2025. So all three bills are important. I would say the HCBS Relief Act is probably the most imminent in terms of, we have a lot of data to show that it's been used and was used by states, and we'd like to continue the funding. But Better Care, Better Jobs, as well as access, are integral to laying the foundation to really growing the workforce and creating more access for folks who want to receive care in the home.
Wonderful. That's great. We really appreciate all the wonderful work that Senator Casey has done and continued to do. He's been a terrific champion for the disability community for as long as he's been in Washington. So we really appreciate that. I do have a follow-up question, which is according to the latest data from the Kaiser Family Foundation, there are 10 states that have still refused to expand Medicaid. You know, this expansion program for many states that has opened up, great avenues of federal funding to expand HCBS and reduce the waiting list. Congress has tried numerous times to kind of grease the skids, if you will, and try to get these holdouts to expand, but those efforts so far have not gone anywhere. What can be done beyond, legislation?
It's a great question. And just to throw a joke in there, I wish I really knew the actual answer to that, but short of having a crystal ball and understanding what could really move those states, I'm going to say that keep pressuring their state officials on expanding. We're coming up in an election year, and I think it's really important for voters to encourage their reps and senators to pass or co-sponsor and support federal legislation like the one we were talking about that Senator Casey leads, which would, like you said, infuse considerable amount of dollars into the state Medicaid budget. But I definitely think it has to come from the pressure of folks in those states to keep knocking on the doors of their representatives and asking for this change.
Great. Thank you for that. Next question is also for you, but I think we kind of covered it a little bit, and it has to do with direct care workers and direct support professionals. Uh, what are the efforts that are ongoing in Congress to kind of bolster uh, job security, job quality, working conditions for them? I mean, as we know, the direct care workforce tends to be disproportionately women, black, indigenous, and other people of color, especially, and also immigrant women. And you know, it really is for a lot of these direct support professionals a labor of love, because as they said at the White House care convening a couple weeks ago, you know, we're not in this for the money, but we're really struggling here, and these are workers that want to be able to provide care to stay with the individuals and families that they've really gotten to know and have developed a bond with. Um, but in a lot of states, the reimbursement rates are just not adequate. Can you tell us a little bit about what Congress is doing to address those issues?
Yeah, absolutely. Well, first, just an editorial comment that I agree that, we really bank on the workforce's empathy and passion for the work that they do to do it, but it absolutely is ridiculous, and people should be compensated fairly. And to quote some of my colleagues that we've been talking about, that this is a complex direct care workers provide complex care in the sense that it's varied and it changes, and they do so much, and that's because the human experience, right, is complex. And so we can expect that one solution is going to fix everything. But in terms of what we're doing on the Hill, I mean, I've already mentioned Senator Casey obviously has always championed the direct care workforce. He did just introduce a new bill, which is the Long-Term Care Workforce Support Act, which supports direct care workers across the long-term care spectrum, and that's because it's recognizing that to support HCBS workers, we also need to strengthen and grow the workforce as a whole, because it is often the same workers, rotating from the home to an institutional care setting, and so this is really an industry-wide crisis. And so, aside from really trying to focus on the big picture and trying to patch the Swiss cheese model that Nicole talked about, there is, like I said, the HCBS Relief Act, which is something that we've been trying to really champion and find Republican support for, just because there's the evidence from the fact that all states took up the money. I also wanted to mention the fact that Senator Hassan's bill passed the Senate, which Senator Casey has supported, and is also part of the HCBS Access Act. That bill, I believe, collects better data on the situation regarding the workforce, and sort of does a better job of capturing where we are as a country. And then, mentioning as well that the HCBS access rule came out, just the other day, requiring that 80% of Medicaid HCBS payments directly compensate direct care workers rather than cover administrative overhead costs. And this is really important because there's even been some preliminary research showing that more money that's been spent in states hasn't directly flowed to direct care workers' wages, and a lot of it has been used for administrative costs or upgrade in technology. So having that regulation to pressure and make sure that that money is getting into the pocket of workers is extremely, extremely important. So yeah, I think those are the few things that are timely to highlight.
Thanks, Allison. Because you brought up the new rules, I'm gonna go a little bit out of order here and throw this next question to Nicole, which is if you
Michael,
could talk,
hi, Michael, I'm
what,
sorry. Sorry, this is Rachita. Sorry, can I interrupt for 1 second?
yeah,
I know Allison has to leave early, and so I know we said Q&A, we left that for the end, but there is a question specifically for Allison. So I thought before she leaves, if she could just answer that. Someone asked for individuals who cannot travel or have the opportunity to meet with Senator Casey and share their story. How can we connect and advocate for legislation?
Well, first of all, if you're not a constituent, so if you're not a Pennsylvanian, I would say that well, everyone has access to me, so we're happy to share my email and connect that way. So I just want to put that out there. That as an aging committee and as representatives of Senator Casey, that we're always here to support you and also hear your story. But very importantly, wherever you are, wherever you're living. It's really important that you talk to your federal reps and senators. Just because, of course, talking to Senator Casey, he's already on everyone's side on this issue. So, and it's great to talk to people who agree with you, but we really need people talking to people who don't agree or don't know about the issue. So please, 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 I would really beg for you to reach out to your state senators and representatives. And if you want some more information or like, one pagers on the bill or sort of how to talk about the legislation, I'm so happy to meet with you and kind of talk through that. But that's what we really need is a push from all of you to your state representatives.
thanks,
Thank
Alex.
you. I'll pass it back to you, Michael.
And thanks for the question. It's a good one.
Thanks, Allison. Nicole, since Allison talked a little bit about the ASA rule that came out on Monday, I was wondering if you could go in to a little bit more detail on that. I know it requires states to set up, a grievance system and create uh commission to
An advisory board. Yeah.
yeah,
Yeah. Yeah, happy to. So this week and actually unsurprisingly, excitingly in Senator Casey's bill, the Long-Term Care Workforce Support Act, you'll see similar ideas, but broader, because it was very exciting this week that there were two big regulations that came out, the access rule, which was tied also to the managed care rule, and then the nursing home staffing rule. One thing really, I just want to like plug the Senator Casey's piece of legislation because it is so important, because we know that whether it's a worker who's a direct care worker who's supporting somebody in HCBS, very often that same worker might be working in a facility on the weekend. We really need to address the full scope of the long-term care workforce problem, which is what's really exciting about the Long-Term Care Workforce Support Act. But something that will bolster it and really will also give us data to show how things like this work is the access rule and the managed care rule. And the access rule requires, unfortunately, it is narrow, so it doesn't include the full scope of the workforce. It's only for folks that are classified as homemakers, home health aides, and personal care aides. But it does require that that 80% of the Medicaid rate that is going to fund the services for that for somebody goes to the wages of the worker who's supporting that person. So that's major. And there was a question on this that I answered in writing, but just to name that it wasn't it wasn't an oversight or it wasn't an omission because the administration doesn't care about direct support professionals. Part of the complication is because there's currently not a standard occupational code for direct support professionals, so you can't be classified as such, but that's something that we're working on. So we hope to see that extended beyond just those categories of workers. But the bigger piece, the advisory board, is going to cut across all of the different work types of workers. So that the access rule also requires the creation of advisory boards to look at Medicaid rates and how they tied to direct care worker wages. Because worker wages are tied into the Medicaid rate, if there's not oversight and investment into Medicaid rates, like I was mentioning in my earlier answer, that is why we see stagnant wages. And so the fact that this advisory group now needs to come together to be reviewing rates every 2 years, and also that advisory group needs to include impacted folks. So it needs to include direct care workers themselves. It needs to include disabled people, aging adults, family caregivers. So it really is a big step, and something that, again, could be bolstered with legislative activity like passing the Long-Term Care Workforce Support Act. And the other big rule was something that was more related to nursing homes, so I won't necessarily touch on that a ton. But the reality is that there is a recognition, I think, coming out of the pandemic of the value of this particular workforce, that direct care workers weren't always seen as the frontline workers that they are, and of the huge variation in the work that they do that Allison was highlighting, right? Because direct care workers can be everything from a job coach to somebody who's supporting somebody to get out of bed and ready for their day. And so we need to be valuing that workforce and also looking at the rates. So there are some exciting administrative pieces, but really in terms of getting the funding that we need to see legislative action.
Thank you, Nicole. Great information. The question is for Amanda. Can you talk about your experience having to fight to get on the wait list for HCBS, and how does that differ in Maryland from other states, if you have any insight into that?
Michael, thank you so much for asking me my favorite question. I had to fight to get on the waiting list, and I was denied 3 times because my cognition is quote unquote normal. I graduated from University of Maryland with a 3.8. I have a bachelor's degree. But the fact that my cognition is normal doesn't cancel out the fact that I have a lot of needs physically and that I need basically total assistance with my activities of daily living. So after being denied on the waiting list for the 3rd time, I had to retain counsel in order to get put back on the waiting list. Unfortunately, my family had the means to do that, but I don't know what happens to those who get denied services and don't have the means to advocate for an appeal. And people whose cognition is normal, but they have a lot of physical needs, should not slip through the cracks, because it's almost like we're penalized for being intellectually fine, but it shouldn't cancel out the fact that I can't get out of bed, right? So there's got to be a solution that makes sense for everybody and takes everybody's needs into account, as well as their abilities.
Absolutely. The last question is for Jennifer. You mentioned that you relied heavily on both paid and unpaid caregivers. What are your thoughts on the direct care workers orders? How has it impacted your ability to find and hire caregivers, and what are your recommendations for what to be done to address those issues?
So in our state, we've gotten rid of the waiting lists, but there are plenty of people that are still in institutions because they cannot find caregivers in the community. And my case is unique. Like I said, I do have caregivers, but that is not the situation. And really, we feel like it is a rocky floor that it could change at any moment, depending on legislation, who gets into office, and just the state systems that we have. It's not very sound. It can change at any moment and hurt people or help people. And obviously, all of us are here today to want to help people. Family members are not paid enough for caring for their loved ones. They're not recognized enough for supporting people's lives. Caregivers themselves, whether they're paid or unpaid, are not recognized for the jobs that they do. We need to be able to provide a living wage to everyone, and also offer them benefits. A lot of them cannot work overtime. And, the care needs are such that people should be allowed to work overtime and get paid for their services. And, other programs that are available, like self-direction could work, to kind of not end the crisis, obviously, because self-direction will not work, but there should be a spectrum of services that are available for people. Agency model, independent providers, self-direction. So a lot of different options, and paid family caregivers, so that people can choose from the availability of what their circle contains, because everybody's story is different, right? So I always say that we need to talk to our legislators. We need to talk to our departments of Medicaid, because nothing will change without the stories that we share about each person's situation and case. Thank you, Michael, for the question.
Thank you, Jennifer. One last question that I think would be very insightful. Amanda and Jennifer, how would your life change if it was a perfect world and you didn't have to worry about HCBS funding or finding and hiring good caregivers? What would that world look like, and how would it be different than what life is now?
Wow, Michael, what a wonderful question. In a perfect world, if I could paint the world any way I wanted it to, I'd be able to get qualified staff easily, and my family would be able to get a break. It's difficult to find qualified, experienced enough staff that my family feels comfortable leaving me with. I have a great deal of needs. I think that we need to, not only do we need to pay staff a livable wage, but we also need to have actual qualifications to say that they're qualified to do work that can be very challenging, to Jennifer's point, and be very difficult. And let's be honest and let's be real. Some of the things that they have to do are not very pleasant. And so they need to be appreciated for that and have experience in doing tasks that can be difficult as part of supporting the person. But they have to have the experience and the knowledge. And there should be a database where you can find qualified caregivers, and the funding should be available to pay them a, com, a competitive wage to make them want to stay. Because we all have to put food on our table.
Okay.
To go along with what Amanda is saying, like I mentioned earlier, there's a shaky floor that we all live on, that even though some of us do have care, it could be taken away at any single moment. The agency or the independent provider could change jobs, go away for any amount of reason. And it's trauma filled. It adds to the stress, which adds to your physical disability after time, not having enough care. There are people that I know that sleep in their wheelchairs because they don't have enough care. We can't continue to treat our people like this with disabilities. We need to all come together as a nation and look at this problem. And my life, I mean, if I knew that everybody, all my friends, had all the caregivers that they needed, it would be a wonderful state of affairs. We wouldn't have to worry about them as mentioned in one of the questions, they don't even get paid for training. If another caregiver trains them on the person with a disability, there's no pay for that person. So, we're even lacking in the training capabilities. But if I had any amount of care that I could choose, I mean, even sometimes if you have a caregiver that's been in your life, their caregiver may not be treating you as properly as you wish, but you have to stick with them because you're not going to be able to find another one. And that is also a scary state of affairs to be in. So there could be a lot of abuse that's even occurring because we don't have enough caregivers to go around. And we need to be better. If caregivers existed and it was easy to find them, it would just be there would be a big collective sigh across America. I think it would be wonderful.
Right. Thanks, Jennifer. We're gonna start now on our Q&A. And the first question I have from Anonymous is there any movement on the House side for the recently passed direct support personnel classification bill that was recently passed by the Senate?
Yeah,
Nicola Allison?
yeah, I'm happy to jump in, since I'm sure Allison was part of the
Yeah,
Senate
I
side.
I have to jump off now, but Nicole, are you okay
Yeah,
answering the question? Okay, yeah.
yes,
You're
but
in
thanks,
good hands with
Allison.
Nicole. And I'll just put it out there. I know this wasn't a question, but because it's legislative related, we really, 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 really want everyone's help in finding some Republican support for this work. It has been the toughest part of all of this, aside from working on really complex issues and ensuring that, we're being balanced in our approach. We really, really do need to find Republican support, even if it's on small incremental pieces. That is the way to get things moving. But anyway, my editorial comment ends there. Thank you, Nicole.
Yes, but I double click that comment. And yes, so the Senate just probably 2 to 3 weeks ago, time is a weird vortex, but the Senate passed under UC, which means unanimous consent, the recognizing the role of direct support professional piece of legislation, which was actually bipartisan. And that bill would create a standard occupational code, or SOC, for direct support professionals, because part of why folks weren't included in the access rule, DSPs, is partially because there is no standard occupational code. The House would be the next that needs to move it. In the meantime, between when the Senate passed it and when now the House is taking it up, the Department of Labor, Bureau of Labor and Statistics, or BLS, has come out publicly stating that they're planning on reviewing the standard occupational codes between now and 2028, which is a 4-year process. So that's still really long. But the fact that they kind of came out with that between when the Senate acted and when the House acted means it's a little bit unclear if the House is going to move on it. Everyone should be encouraging their members of the House to support that bill. But it's a little unclear, but there is hope that if it moves, that it would move by July in the House.
Thank you, Nicole. That's great information. There's a question from the last part. She writes, I live in North Carolina and I have a 33-year-old son who was nonverbal and had Down syndrome, who was on the waiver waiting list for 10 years, and he was paid through Appendix K, which is a pandemic program that was recently discontinued. She has had direct support work. Pardon. DFPs strangers that did not turn out claim more hours than they actually worked, and to write that Nazi had trust issues because of that, fraudulent claiming of hours. Um, why can't Appendix K be continued?
Yes. So, first of all, I'm really sorry, Celeste, that you've had a bad experience since that ended. The Appendix K waiver was attached to the public health emergency around COVID-19. And while obviously we know that COVID is still going on, because the federal government did end the public health emergency, that is why the Appendix K can't be continued. However, that does not mean that states, including North Carolina, can't continue some of the practices that were ongoing. There had been another question that that I believe Maria had asked in the chat around, that or a comment that not in that family caregivers can't be paid in every state, and that is true. However, but there were those flexibilities during the pandemic, like what Celeste is laying out. But 30 states have continued that, and so there are things that state level advocates can do to make sure that those types of programs continue. I will name that when it comes, family caregivers are sometimes the folks that disabled people might want to support them, but we also can't create a system where that's the only option. So we have to be really conscientious of both bolstering and building the direct care workforce so that there are workers that can be reliable and can depend on. But Celeste, there definitely are things that the state of North Carolina can do to make sure that those same protections exist even without an Appendix K.
Okay, thank you. Any other questions from our audience? And just as a follow-up to what Nicole said, many of the disability rights organizations, if not all of them, we have been lobbying Congress pretty hard for them to allocate funding that would allow states to more easily retain these pandemic era flexibilities. What Nicole said, there are 30 states that have continued to pay family caregivers, but that still leaves 20 states that are not. And whether it's a funding issue or or a lack of information or an ideological opposition to it, these flexibilities were a lifeline for a lot of people. And we would like them to we would like to see them be made permanent. But that's unfortunately gonna take some effort and time. Would really emphasizes the importance of all of us talking to our representatives, talking to our senators, sharing our stories about how critical these programs are to us as individuals, our families, our communities. Um, any other questions? Nicole, Amanda, or Jennifer, do you guys have any last thoughts you would like to add?
I would like to say that it is so important that you reach out to your legislators within your state and on the national level. It is so important to get involved. Laws can change with one person. It doesn't take a huge number of people to get things changed. It starts with one person. So never think that your story is insignificant or not large enough to make a system change. It is. Share your stories with your legislators. Get out there, talk to people. In our state of Ohio, we're very fortunate to have a great group of advocates that pull together on for various different advocacy opportunities. So try, if you don't have one in your state, try to form one. It's so important to be able to pull together and pull on a team of people when changes are being made within your state and on the national level. So that is my word of advice to everyone that's out here today, is to try to organize yourself in some form, whether it's grassroots, whether it's only just a few people, because it's going to take a mountain, a village to be able to change some of the things that we have. And just keep fighting for what you want, and the needs that you have. Thank you.
I think it's important, as Jennifer said, to continue to advocate, and also to pass legislation that supports the work of DSPs and staff, and also maybe as a nation to look at ending the waiting list, because people are dying waiting on the waiting list for care, and it's messed up that in my state I don't go to the top of the list until my primary caregiver dies. Like we should end the waiting list if we can find the funding and the advocacy to do that.
Yeah, and I think advocate is always true. I also though know that advocating, especially for a single piece of legislation or meeting with your representatives, whether it's in state or in district or in Washington, D.C., can be a little intimidating. And one thing that I always want to make sure that folks know is you don't have to be an expert on Medicaid or home and community-based services or the workforce. All you need to be an expert in is your own story. And your own story, just like what Amanda and Jennifer have laid out, and what Jennifer said is exactly right. Every story is unique and different, which is why every story should be told. And all you have to know is what your story is, how the lack of access to home and community-based care, how the lack of access to a well-paid and well-trained workforce, what that means in your life. And then ask the people that are representing you to solve those problems through legislation.
That's terrific. There's a question in the chat. Is there a letter that all of us can obtain to move forward with legislation? Teresa, can you clarify what you mean by that? I do know that a lot of coalitions, especially the consortium of constituents with disabilities, we've sent letters to congressional leadership stressing the importance of increasing funding for all aspects of HCBS. And Nicole's organization and AAPD have signed on to those letters. But if you could provide a little bit more clarification, Teresa.
Okay, can you hear me?
Yeah.
Okay, I was taken off of mute. Thank you very much. I guess what I'm trying to, I believe it was Jennifer. I'm in Illinois, and I'm sure a lot of my friends and our family, we call them family here, we're everywhere. We're here online and we're trying to find out, is there some type of general letter or information? I believe Jennifer mentioned something about where we can refer, for reference to when we talk to our legislations, our state representatives, or just get together and try to figure this thing out.
Yeah, so there's definitely, oh, sorry, go ahead, Jennifer.
No, I mean, go ahead, Nicole. You can talk first and I'll talk more about what we did in our state.
Yeah, and so first of all, Teresa, hello. My brother is in Illinois. I'm from Illinois. Illinois breeds really good advocates because it's a really bad system. So um, uh, um, there is a one pager that I'm putting in the chat on Senator Casey's bill, the Long-Term Care Workforce Support Act, that you could leave behind with anybody that you met, that really lays out the issue. Also, the National Alliance for Direct Support Professionals has some one pagers and other things that you can take a look at from their page. But that's really all you need to do. Is all you need is that one pager and the bill number, which is 4120 in the Senate, and ask folks to pass that bill. And this would be with your federal legislators, so the members of your member of the House of Representatives or the state or the Senate. If you're going to meet with your members of the state house, you can share this information and then ask them to do legislation similar to this at the state level.
Okay.
And one of the things I want to add is if you read that one person that Nicole just put in the chat, yes, it is very important for the disabled community, but also just for older Americans. That are aging, they're gonna need care. And the care infrastructure that we need, we really don't have it right now, when we kind of have to begin the process of building the plane while we are flying it, because we have a huge population of baby boomers retiring and aging, and there's no care workforce to prepare for that. So it's really important to stress that regardless of political affiliation, race, whatever, we're all gonna get old, we're all gonna get sick. Many of us will become disabled if we weren't born with a disability. Anyone can become disabled at any time and need care. It's an issue that will impact each and every American at some point. And so it is vital that all of us advocate. We are about 2.5 minutes from 3 p.m. And so if there are no other questions, on behalf of AAPD, we want to thank all of our panelists so much for their time today. For everyone that registered, we will be sending out a recording of the webinar in a follow-up email, and we will also include the link that Nicole put in the chat, as well as Allison's email address for those of you that want to get in touch with Senator Casey's office. And again, thank you for your time this afternoon. Have a great one.
Bye, everybody.
Thank
Thank
you.
you.
Thank you all.
Bye, everybody. Thank you. Have a great afternoon.
Thank
Bye,
you.
everybody.
Bye-bye.
Thank you so much.